Mark Fulcher, and in this clip we're going to have a look at how to examine the ankle of a football player. We're going to start by asking Martine to do some walking for us. So if we get you to walk up and down, Martine, we're basically just looking to see if she has any difficulty walking, whether there's any pain or problems, whether she has an antalgic gait. So if you just take a few steps back there, while you're standing there, can we get you to go onto your tiptoes? So good functional test, does she have any pain or problems with that? For example, if she had posterior impingement, we'd expect that to be painful. Can you rock back on your heels? Any pain or problems with that? And then can we get you to stand on the outsides of your feet and then on your insides of your feet? So it's a good way to have a look at the subtalar joint range of motion to see if there's any pain or stiffness. Also, while you're standing there, we're going to get your feet still on the ground. Can you drop down into a deep squat? So sometimes if the patient has anterior impingement or has some dorsal spurs around the ankle, there'll be some pain with that or a loss of movement. We're also going to get you to stand on one leg, so let's have you stand on your left leg. So we're just having a general assessment of her balance and proprioception. If you look at the ceiling, and then can you stand there balancing with your eyes closed? So all of those things make balancing progressively more challenging, and if the athlete has impaired proprioception, may be important. So we're going to come have a seat on the side of the bed here, Martine. So I like to palpate the athlete's ankle with them sitting with their legs dangling over the end of the bed. And so I start laterally, so I start at the lateral malleolus and palpate along the posterior aspect of the distal fibula and lateral malleolus, looking for tenderness. Over the tip of the lateral malleolus, and then anteriorly to that around the ATFL, which is the most commonly injured ligament around the ankle. Moving more inferiorly to the base of fifth metatarsal, where athletes can develop stress fractures or have an acute fracture. And then over the anterior ankle or talar dome, and we can identify that by dorsiflexing and plantar flexing the ankle and feeling for the ankle joint, so palpating there. Over the tip of the malleolus where the deltoid ligament is, and then extending along the posterior border of the medial malleolus. So palpating around the ankle joint proper. I then palpate the navicular tuberosity, which is a fairly prominent bony landmark around the medial ankle, and then over the dorsum of the navicular. Another important place to palpate is around the syndesmosis, so the anterior inferior tibiofibular ligament, and palpating proximally up the syndesmosis. So those are all useful landmarks. From there, I like to assess ankle strength in a position of plantar flexion. So ankle eversion or perineal strength. So hold there, Martine, stop me pushing this way. So hold hard. So it's an important test if someone has ankle instability. So perineal strength is very important. And then ankle inversion, hold your ankle there, stop me pushing inwards. So testing her tibialis posterior or inversion strength. There are a few tests that we can do to assess the syndesmosis. So if we think an athlete's injured their ankle syndesmosis, we talked about palpating the ligament, so the point test. We can also do a squeeze test. So if we squeeze the tibia and fibula together proximally, and that causes pain around the syndesmosis, more pain than squeezing more distally, then that may imply a syndesmosis injury. An external rotation test is also described. If that's painful and we have medial pain, we might be thinking a deltoid ligament injury, or if that's creating pain around the syndesmosis, we might be thinking about a syndesmosis injury. So those are some useful tests. We're then going to get you shuffle back. So just the foot and ankles hanging over the end of the bed. And in this position, I assess ankle inversion and eversion, so looking for the talar tilt test. So is there any increase in range of motion there, and they're symmetric. And also I test an anterior draw. So bring the ankle up into 90 degrees or into neutral, and we're trying to move the ankle forward relative to the tibia. So good solid end point there, no real increase in laxity. Martine, we'll get you to roll in your tummy. So in this position, I'm going to have a look to see if there's evidence of anterior or posterior impingement. So we take the ankle up into 90 degrees. So posterior impingement creates pain around the posterior aspect of the ankle with plantar flexion. So I think we get good control when the athlete's lying prone like this, and we're moving the foot into terminal or forced plantar flexion, asking if that reproduces posterior ankle pain. So not so interested about anterior ankle pain, which sometimes happens. Does this create posterior ankle pain? That's the posterior impingement test. And then looking again for anterior impingement, kind of like when we're asking the athlete to squat while standing, we're providing forced ankle dorsiflexion. Does that reproduce any anterior pain? Is the range of motion restricted? If you just shuffle back down the bed, so your feet and ankles are over the end of the bed, we're just going to take the opportunity while she's lying prone like this to have a look at the Achilles tendon. So first thing, we get a nice side-by-side comparison. So is there any obvious swelling or thickness, classically in the mid portion or around the insertion? So both of those tendons look normal. We then palpate the tendon, looking for any tenderness, bearing in mind that they're generally an uncomfortable structure to palpate. We then can do a squeeze test. So we squeeze Martine's calf and we can see her foot moves into a plantar flex position. If the Achilles tendon is ruptured, we'd expect no movement in the foot and we may palpate a defect in the tendon. So while we're doing that with her feet over the end of the bed, another good position to do that in is with her knees flexed to 90 degrees. So squeeze test on both sides. And the other thing we can do is directly compare the resting position of both of those feet. So if she's ruptured her Achilles tendon, we'd expect to lose some of that plantar flexion and we'd see an asymmetry between the two sides. So this is a good opportunity to assess the Achilles tendon. So that's how I assess a footballer with an injured ankle.